reason, we've not seen across the board a discussion on the dangers of the pandemic. And why is that? It's not as if India has flattened the curve. The numbers are still raging, but it's not raging in several headlines. But we on Mirror Now are continuing to keep the focus on those numbers. This is no time to be looking away from those numbers. While India is sitting at further opening up, this is unlock phase 4.0 right now as we speak. The numbers that we have is a total COVID-19 reported of 3.69 million across the country. And moreover, the daily spike in cases per 24 hours. It's an average of 75,000 cases per day, which we've seen in the past 5 days. And these numbers, the rise in cases particularly, have been the highest that has ever been reported globally. India is very fortunate, of course, to have a good recovery rate. It is 77%. But is that really enough? India in the past has been praised for a strategic job towards reining in the COVID-19 numbers. We had one of the earliest lockdowns, but has all of this really worked on ground? We're going to be discussing this further because we're sitting on a huge spike in numbers on a daily cases. Under no circumstances can this be left behind. There is still work to be done. The curve is not flattened, and this is not normal time for the country. Let's throw this open here to our panelists. We have Dr. Sanjeev Bagai, chairperson of Nephron Clinics, here with us. We also have Dr. Anant Bhan, who's the researcher with Global Bioethics and Health Policy. We're also getting in political voices. This is particularly from state governments, the top 5 state governments which are looking at the largest COVID-19 positive cases. Clyde Crasto, spokesperson of the NCP, Kovai Satyan, spokesperson of the AIDMK, and Mr. R.P. Singh, who's the National Secretary of the BJP. Thank you all, gentlemen, for being with us. I'm going to first start here with Dr. Anant Bhan. Dr. Bhan, we've seen in the past of how these numbers are being considerably an effort to downplay the numbers in certain areas. Do you think this is a time where we still need to be as aggressively discussing and talking about the horrors of the pandemic? Because we have never sat on a curve that has flattened. This is a curve that continues to rise on a daily basis.
Sure. Thank you for having me. Absolutely. I think, there is a lot of talk about the fact that, we have some positives like low death rate. We also have a fairly good recovery rate, but it's also important to remember that the absolute numbers matter. And as you were highlighting in your introduction, our absolute numbers are now pretty alarming. We have the most rapidly increasing pandemic in the world in terms of numbers. Our rates are going up. Alarmingly, I think over the last week or so, or slightly more, we've also seen our death rates slightly increase. So again, that is a cause for worry. Listen. At this point of time, I think the pandemic is an absolute important area for us to focus on. The flood situation is another one. We need to focus on. The economy is the third. I think these are the 3 main important areas where, all of us in the media, in academia, in policy circles need to be really discussing this. This is not a time to loosen up. This is not a time to move away from a situation where we are not, we should not be really avoiding the pandemic discussions, because my concern is that as the situation is clearly that the pandemic is spreading to rural areas, that we are seeing the spike there, our health systems are relatively weaker there, we could have major problems if we don't focus enough on that. So absolutely, while it's important to also focus on non-COVID healthcare, from a healthcare perspective, COVID is certainly still a priority which we should not be moving away from.
Right. Okay. Dr. Bagai, if you heard that, and help us understanding, please, on what more that the government needs to do. This is of course at a time when all of us need to be working together with the government instead of criticizing on what hasn't been done or what is being looked away with. There is only a focus on the recovery rate, not on the rise in numbers. What is more that the government should be doing today? Because there is no precedence. While we talk about India, it's not as if there is a formula available. We are looking at other countries suffering as much, but our numbers being much larger, so we have higher numbers even for the pandemic then.
Good evening, and good evening to all the panelists and the viewers. Thank you. I think this is a very important question. I think when at the start of the onset of this pandemic, which was in end Feb, March, and we had the lockdown really early and very strict, I would shudder to think what would have happened if we hadn't had the lockdown. And although we may find an elusive cure for the much-awaited COVID vaccine, this catastrophic pandemic is actually the single most disorienting global hit. So this is not something which has just hit India. It's most of the advanced countries have been hit even more. Very often we keep saying that it's a central policy and health is a state subject. I'm a very firm believer that health is an individual subject. So now it is a societal movement and society's comprehensive collaboration with the government to help overcome this. As the previous speaker said, we are at a very critical juncture. We cannot stop debating and discussing this because this is the best mode to give a public awareness campaign on a continuing spree. We've had a fairly good recovery rate, but mind you, this is a bushfire and every wood which comes in its way. We know that the transmission is now more airborne. So therefore, very briefly, just to capture right at the onset, we have to avoid the dreaded Cs, closed spaces, crowds, avoid the comorbids, reverse isolate them, be careful of community living, and be careful of sanitation. And on the other hand, it is important that we have a large segment of asymptomatic carriers and silent spreaders and super spreaders. We know that this herd immunity concept is a long way away, so we should not bank on that. We also know that the vaccine is many months away. We should not bank on that. What we can do is not to be complacent. Do not fall into a mental fatigue. We have to assist the government. The government can do as much as the society is cooperating. So I think it's on us as individuals, collectively as a society, to keep social distancing. We also know that the social distancing norm is well more than 6 feet. So please keep a good, safe distance and keep yourself hygienically clean. Wash your hands. Please wear your mask. Right? In the end, just 15 seconds more, Sahar. People are wearing a mask, sometimes not wearing. Criminal offense. If you don't wear a mask, it's the worst thing which you can not only do to yourself, to your family, but to your country. The next and the last point I would like to make is don't wear a mask which is like a radar on the forehead or dangling below your chin. 82% of transmission, which is airborne, goes through your nose. We have to cover the nose. And I think it's the duty of every citizen to point out to anyone else on the roads or on the streets who are not wearing a mask and appropriately that please wear a mask and properly.
Absolutely. Dr. Bagai, in fact, thank you for reiterating that. We've now been listening to this for the past 4 to 5 months. It sounds like something that everyone knows, everyone understands, but to keep reiterating the very basics, keep the social distancing, keep the mask, wear the mask properly, avoid crowded spaces, do not go out in large numbers and crowd up spaces here. These are the basics that we need to live with. The country is opening up, but the numbers are still not normal. Let me go across here and this is keeping in mind in the rise in numbers of what we've seen in Maharashtra. We've seen what has happened in Mumbai, and now we are seeing how the focus area is Pune. Pune, which is currently looking at the highest number of active cases. In fact, the numbers have gone beyond what Delhi has reported earlier as well. We have Mr. Clyde Castro, spokesperson of the NCP, here with us. Clyde, in your view, what more is it that the government should do? Agreed that people should be understanding as much. We have seen this in festive season as well. In fact, we were seeing this just today, where the BMC went to extreme lengths to make sure that festive spirit is not dampened, preparedness in place, even during Visarjan, very strict guidelines, but none of that was followed. In fact, in Pune, officially the authorities have said the reason for the recent spike is because people stepped out in the festive season. Do you think state governments still need to be more strict? This even at a time when an instruction that comes in from the central government that you need to open up.
Sir, to begin with, I'd just like to just tell you, repeat what Dr. Sanjeev Bagai just said, is that the government can do as much as the society will cooperate. That's, I think, something that is like golden words that I heard from him. And I think that's the most important thing that we need to actually understand now, you, me, everybody who's out there. Because what is happening is the government is doing its best. I mean, I'm not going to just stick to my government in Maharashtra. I'm going to talk about the whole country. It's not about you or me or this party or that party. Every government is trying to do its best, but the people need to cooperate. Now, like you said, during this whole festive season, during the Ganesh Utsav, people have in a lot of ways cooperated and done. I mean, today was one day. Yes, I did see some visuals that also has been taken care of. Like in Pune, people, the administration is complaining that because of the people coming out, the thing is spreading. That's exactly the whole point. The government is going out of its way. Well, it cannot stop. It has to continue doing and keep doing more than what it's doing now. But until and unless the society cooperates, this is not going to stop. This will only increase because if we gather together, if we come together, like again, I'll repeat what Dr. Saab said. There are people who are wearing the mask only covering their mouths and they're not covering their nose. So how does that work? I don't understand. It's like, if I have to give an analogy, which is a very strange analogy that I'm giving you, is like you see a lot of times people on motorcycles or scooters, they have their helmet on that mirror stand, or they have the helmet on their arm, but they don't wear it on their head. So how does that protect you? It does not protect you. So whether it's wearing a mask or whether it's keeping social distance, until and unless the people cooperate with the administration, until unless people cooperate with the government, this cannot be stopped. We will do our thing, the governments will do their thing, but the people need to cooperate and make sure that the government can do its job well.
Right. Clyde, I'm going to come back to you in just a bit because this is not something that we want to catch on blaming the people entirely. Yes, we need to be responsible here, but there are questions on government preparedness, respective state government preparedness on health infrastructure. 2 months of the lockdown, we had not seen preparedness. Pune has been suffering because of that delayed preparedness. I'm going to come back to you on that in just a bit, but I'm going across here to Mr. R.P. Singh, National Secretary of the BJP.
Can I get
Mr.
10
Singh,
seconds?
In your view here, this is concerning the rise in case in what we are looking at in BJP-run states of Karnataka and Uttar Pradesh here as well. But are you in agreement with Unlock Phase 4.0? Agreed that the country needs to open up, we need to work towards the economy recovering, but are we prepared as much for 4.0? Our numbers don't say that we're prepared for Unlock 4.0. Our health infrastructure doesn't give us that confidence that we're prepared to open up this early in the day.
Well, let's see with this perspective, patients versus the bed ratio. As I understand, then we are already there with almost 3 times more the beds which are required for the active patients right now. And we are still adding on the number of beds. Patient versus the required number of ventilators, required number of oxygen beds. So overall, the infrastructure has been countrywide. I'm saying across the board in various states, somewhere less or somewhere more. But yes, nations are geared up for this period. And as we open up, we understand that there will be more cases. But are we able to treat those cases? What's the fatality rate now? What is the number of patients who are getting recovered now? Is almost, if I can understand, is 70% plus. So gradually we are moving on. I mean, and I remember when it's to 25%, people say it's quite worrisome. Now we have crossed 70%. People are little satisfied. So are we geared up enough? Yes, we are geared up enough as a nation. As facilities, we are geared up enough. And now with the opening of economy, yes, initially with this phase of where we have allowed people to move around the state, inside the state and across the states now, probably there will be little problem. We understand it will create some problem. But yes, as a nation, we are prepared. As states also, the state governments are also gearing up for it. And we have good experience now. All states put together, independently also, have good experience how to deal with any situation. That's why special zones where it will be containment zones where specific things will be done in a different fashion. And also, wherever economy is open, where other things are open, like for example, metro is going to be open. Now, it's not that we are opening the metro altogether. It's going to be open in phases now. Next will be schools and colleges. Again, it will have to be calibrated. How do we open schools and colleges also? So gradually we have to bring back the economy. We have to bring back the society back to the system. We can't keep sitting on lockdown
Right.
for long.
But Dr. Singh,
moving ahead step by step.
Dr. Singh, do you think the process of unlocking needs to run parallel by upgrading the health infrastructure here as well? Has that happened?
Sahar, can I come in? I just have a point to make, sir, please.
This is for Mr. Singh. Very quickly, please.
Well, yes. I mean, I'm quite confident, and we are quite prepared for coming days, and we are keeping this in mind that yes, with opening of economy, with allowing metros and gradually coming to school and colleges at the next stage, we are well prepared for that. And even now, the more infrastructure being added. I remember we never used to have PPE kits, and now we are exporting the PPE kits or masks for that regard. These are very basic, but I'm telling even ventilators for that regard. I mean, so country has moved much fast at a faster speed and has covered quite a distance. And I'm hopeful, and by that time the vaccine will be also there. I mean, by some time, another probably few months, vaccine will be also there, and that will also help us to beat the virus.
Yes, Mr. Clyde Crasto, you had a point to make here. Please come in. Are you convinced with what you've heard as far as preparedness here? Are we running parallel with that preparedness as we unlock? Are you in agreement with the central government here on this?
I'll tell you something, right in the beginning, I told you, this is not the time to say that you are wrong and I'm right or I'm, different from you. The point here is we need to work together. And the central government also is doing its bit. Yes, there are a few lapses that we can even look into, but let's talk about it later. Now's not the time. What you said earlier, I just want to, clarify that. Nowhere am I blaming the people, I mean, whenever there is a situation like this has come up, you have to understand what I'm trying to say. What I'm trying to say here is there is a section of people who's not cooperating. There's a lack of cooperation from these section of people. And because of their non-cooperation, the majority of the citizens are suffering because, like we all know that this is a spreader. This virus is a spreader. So if a section is not going to listen and if they're going to get infected, it's going to spread to the rest of the people. So that is what we're looking at, and understanding from these people, cooperation from these people, and that's how it's going to work. Now, you also mentioned that, how we were a little unprepared in the beginning. And
no, but Clyde, let's talk about Pune here.
No, I'm coming to that. Exactly what I was about to come to.
The government, the local authority was running behind time and even getting the jumbo facilities ready, which should have been ready.
I was just coming to that, sir. You just spoke my words. I was just coming to that. Let me tell you, it was not that we were delayed or we are not looking into it. Now, let me tell you one more thing. All of us, the whole country was taken completely by storm with this whole pandemic. And when something new comes up, it takes a little time to understand it. It's not just the state government, even the central government. All of us took time, and you cannot blame them because this is something that nobody knew about. So if you're specifically talking about Pune, I don't think that there was a delay or a lax from the part of the administration. They were doing this. The facilities came up today. The facilities are all there in place. Things take time. Nothing can come up overnight. And I think we've done a very good job, whether it's Pune or Mumbai or anywhere else in Maharashtra. I think we've done a very good job. Look at the statistics. If we are talking about statistics, we have an 80% recovery rate, 83 days doubling rate. 0.83% is the ratio of deaths that are happening. The growth in death rate. So things like that. Things have come into control. Yes, the cases are rising. Obviously, the cases are going to rise because we are opening up slowly. The economy is suffering. So we need to open up slowly. So it's like a catch-22 situation. On the one side, if you don't open, people are going to be upset. If you open, you're going to have a spread. So we are working on it. We're trying to balance it on both sides.
All right, so this is of course understandably a tightrope walk here, but yet again I see this celebratory note as far as our recovery rate is concerned. Of course, we are very fortunate. We were lucky and we have worked towards that very high 77-point recovery rate here. But Dr. Bhan, is that a number? Is the recovery rate the number that we're going to be stuck on here? Are we addressing other issues here by shying away from not criticizing any government because they've been working too hard? There are aspects of authorities and governments being in denial as far as community transmission is concerned. There is still a very, very low testing rate here. We're not increasing that as well. We're still not talking about this as actively. We cannot be stuck on a good recovery rate and sit back.
Absolutely. I mean, I think we should certainly acknowledge the positives, and the positives might be a function of our response, our early lockdown response. It could also be a function of the fact that, fortunately for us, probably the first, whole swath of infections which probably happened in the relatively younger age group, because the older ones, those with comorbidity, were sheltered in by families. They were not going out in the lockdown. But now what you're starting to see is, as more and more unlock happens, these exact individuals who are more at risk are also being potentially exposed to infection. So my hunch is that we need to be very watchful on our death rates as well. It's quite likely that we might start seeing some degree of spikes, at least in some parts of the country, as this infection continues to spread. Remember, as the number of infections also rises, the possibilities of the infection reaching those who are most vulnerable, as Dr. Bagai was rightly pointing out, those who are old, those who are comorbid, is also increasing. And as and when they get those infections, it's highly likely that they might have complex, manifestations, and that would be again having implications on our healthcare needs, because then, those people would need to go to hospitals, you would need to have the beds. But also remember, I keep hearing in these panel discussions this description around beds increasing and our mega facilities we come up with, but we seem to shy away from the longer term health system strengthening and resilience perspective, which means that, where are we going to get the staff from? You can build these mega stadia or you can have large facilities, but where are you going to get the doctors, nurses, paramedical staff? You can't create them overnight or even in a few months, right? So again, that requires us to start thinking about moving away from a mopping away strategy, which is to say that there is water which is leaking, and then you keep mopping the floor, and talking about where do we need to shut down or stop the leakage from happening. And that leakage is because we don't have strong public health fundamentals in our policy, and that is extremely important. The second thing I want to highlight is that, I think we also need to move away from a blame strategy, which is to say...
Manpower in the health sector here. Dr. Bhan, please stay. Please, I request you to hold that thought. I'm going to go across to Dr. Bagai in just a bit here as well. But I'm going to raise this point that you've just mentioned here with Mr. Kovai Satyan, spokesperson of the AIDMK, and the reason that we're also going across for a spokesperson from the ruling government in Tamil Nadu here, because Tamil Nadu right now has the third highest COVID-19 positive cases. It is rising consistently here. Mr. Kovai Satyan, appreciate you being with us this evening here. If you heard the last bit of the argument, manpower in the health sector, help us understand Tamil Nadu's preparedness here. There have been cases of Tamil Nadu hospitals facing a shortage of nurses. There is a loss of manpower. 43 doctors, unfortunately, in Tamil Nadu have reported dead, succumbing to COVID-19.
Yeah, there are two stages to your question, two answers to your question. The 43 was rejected by the All India Medical Council representative of TN. So that number was not sacrosanct, which never came up after that. But to answer your question of increasing of manpower, I agree with the earlier panelists who clearly said that in terms of healthcare infrastructure, you can have physical infrastructures being created. But the real core issue lies with how do you create the knowledgeable workforce, the doctors, the paramedics, and frontline workers. That is most important critical factor in the entire healthcare system. So as far as this COVID is concerned, the last 5 months, the Tamil Nadu government in totality had appointed about close to 15,000 people, out of which there were doctors, paramedics, nurses, and frontline workers in the healthcare system. And yes, the numbers are on the higher front because this state is now closing towards 500 crore of testing since the time the COVID started. So the positivity rate is somewhere at about 8.9%. So having said that, as per the global norm and what has been recommended by the global players, you do more aggressive testing, you do more of contact tracing, you try to treat them at the right time, then probably, yes, there is a way that you can flatten the curve. Like every product will have a life cycle, PLC we call it. I think this disease life cycle is still remaining a mystery among many. So if there is a clarity on the disease life cycle, then I think we'll be able to better prepare ourselves for the next stage or the next course of action that is going to follow.
Can we expand on that, please? If you could further explain that.
See,
Better
there are multiple
preparedness
theories which is
in
emerging.
what sense? What is it that we've seen on ground that is going to instill more confidence here?
Yeah, see, there are multiple theories which emerged initially when the COVID started regarding the strain of this virus and regarding how the treatment has to be. Are there any alternative medicines available? So there were so many permutation and combination being worked around. I think each and every state had got their own learning. As far as Tamil Nadu is concerned, now there is a good amount of alternate medicine also giving a good amount of results like Siddha and Ayurveda. Alternate medicines are being tried out. The first stage was to increase the infrastructure, the overall healthcare infrastructure of the stage to face this pandemic. I think now we have about 75K and dot COVID beds, and with a private-public partnership, we have 146 testing centers working round the clock. There are about 15,000 and dot force of healthcare professional support from the regular government doctors. For example, like a city like Chennai, there are about 20K frontline workers on the field on the sanitation front. So this has thrown up a challenge to create the entire infrastructure per se,
Okay.
physical and healthcare infrastructure. But what's happening is there are theories emerging that this will be the first wave, and there is people who have contracted COVID. Their antibody lasts only for 3 months. So there is a different strain which is coming into them after 3 months. So there is no end to this particular disease. That's why I called it as disease life cycle. Every disease will have a life cycle. It
All
will
right.
wean off over a period
I'm
of
going
time.
to
So
take
now
that issue
what
of
actually...
multiple theories to Dr. Bagai in just a bit. But Kovai Satyan, are you in agreement with the timing of Unlock 4.0? Do you think this is running parallel with preparedness of your government in Tamil Nadu?
I would say as far as Tamil Nadu is concerned, we are a bit in a cautious approach. Like even though the central government has said the 7th metro will open and yes, 9th to 12th standard people, students can come in with parent consent. These kind of relaxations are there, but still we are conservative. We are not allowing the schools and colleges to be reopened or any staffs to be coming in. And as far as the entertainment is concerned, there's still a cap. And as far as congregation of political rallies of 100 plus people is still not allowed. We still have taken a conscious approach. I think the first stage where we have reached to create a healthcare infrastructure, I would say if there is an input of 100, now the discharge are at 76%, there is an output of 76%. So which means that there is an element of load bearing that is practically possible by the state. So now considering the economy, in the economy and life has two are the two eyes now. Now considering the bottlenecks and the challenges we face towards the economy and each and every individual facing the challenges he is facing towards economy, I think the lockdown will definitely is totally targeted towards easing down the economy pressure on each and every individual as well as the government. So we would say that till such time we go to the next stage. For example, countries like
Okay.
South Korea and Japan had tried this and they went back again for a lockdown since the cases started spurting and they are not able to manage it. Considering the population of India with the healthcare which has been stretched to this last elasticity, and I would say that this is a cautious approach and we need to be really cautious, not
All right.
complacent at this point of time.
Absolutely. No, entirely in agreement that we need to continue to remain cautious. This is still not a time to party. It is Unlock 4.0, but we still need to be conscious. As I said at the start of the show, and several of you agreed here as well, that we never flattened the curve. The numbers are still rising. Dr. Bagai, as far as these multiple theories are concerned, should we get lost in these theories? Because what we're trying to do here is to still keep the focus on numbers. The numbers is the reality here that we have partially looked away from in the past few months.
Interesting question. First of all, I think there's an old saying: don't ask a man his salary and a woman her age, and a scientist whether it's community spread. But on a more serious note, this has been in community spread for a while. And I think sooner we recognize this, it's better we'll come to grasp with what we need to do. The complexity of health is beyond numbers, and no graph is intuitive. So we can never actually be 100% accurate to say which way the pandemic is going to pan out. This is going to be there for a better part of the next 3 to 4 months, maybe 5 months. It will wean off because that's the nature of the viral diseases. But our aim is to keep the case fatality low, and I think that's where we have succeeded. We should not forget that in a bursting population with hugely overcrowded metro cities, we've kept with a huge amount of comorbid conditions, we've still managed a pretty good job done to keep the case fatality low. But but I think there are two important points I'd like to make. I think while we are grappling right now, we need to start thinking of what we need to do for the next 5 years, 10 years. And just allow me just exactly 60 seconds because it's a very, very important point I would need to make. We need to strengthen our public health care system. I think the entire globe has been languishing because of chronic underfunding of public health. I think we need to concentrate on public health as a national mission. We need more district hospitals with medical colleges to increase the paramedics and the medics in terms of doctors and nurses. It takes a better part of 9 to 10 years for one doctor to become a postgraduate. So we need to start the process now, and I think the central government is already doing it, but we need to focus on it. We need to hugely give a robust healthcare. There is too much focus on the metros, and the major hospitals are all in metros. And in the end, I would like to give a very classical example. There are 2 or 3 huge medical. And when the economy crashed in 20s, in the global economy crash, these people who were the steel and the glass capitals of the world shifted towards education and medical hubs. And now if you consider places like Pittsburgh and Toledo, they are the world's leading centers of hospitals in terms of tertiary care, quaternary care, and medical education. What we need to do is we need to create medical cities, metros. Healthcare is the largest employer in India. We will give ample opportunity of employment. We will increase the public healthcare in terms of tier 2, tier 3 cities and into the villages. We will encourage the doctors, once we have that infrastructure in smaller places, to shift there and permanently work there. We need to give an environment. We need to give healthcare to the poorest. We need to reach out to the remotest. And I think digital healthcare and technology must be focused on like hand in glove. That's the only savior for us. If we need accurate data, we need correct and precision medicine. We need preventive healthcare beyond affordable, accessible, and accredited.
Bagai, we're hoping that this is very much in the near future here of what our learnings from COVID-19, of fighting COVID-19, the learnings of which can be implemented for other diseases, for other seasonal diseases that we see coming up year after year as well. This would eventually be the big learning for us. But for the situation at hand here, Dr. Bhan, you wanted to come in and raise a second point. Do that, sure, but please also answer this. To address denials of the government, should we be very quickly, Dr. Bhan, should we be marking these denials? Is there community transmission, as some state governments have independently said, but it hasn't come in from a central body? What about testing? Testing is still very much low. India is at number 3 in the total numbers of COVID-19 cases here, but testing, India stands at number 10.
Sure. So, I mean, I don't think it helps anyone by shying away from the truth. And the truth is that there is community transmission. If we don't have national level community transmission, it's certainly there in many pockets of the country. I mean, listen, we have a variable pandemic going on in the country. In some parts of the country where the infection started early, we now have a stage where the infection has spread pretty much almost throughout a city or a state. Whereas there are other parts of the country where, the infection spread is relatively younger and it's starting to rise in terms of number of cases and its spread as well. So it's never going to be the case that you will argue that there is community spread in all parts of the country. But to say there is no community spread anywhere in country is also a fallacious argument. And I don't think we should be buying that. Sometimes we just hide behind these definitions as well. But as you are rightly pointing out, at the end of the day, the real metrics are, how effectively are we testing? Is testing available to everyone who needs it? I still hear of stories, from rural parts of my state where people say that, they've been waiting for test results for sometimes 3, 4, 5, 6 days. So if that is still the reality, 6 months into a pandemic, then it does tell us that there is a problem with our preparedness. The second thing is, the states which have done relatively better are those where you have built a partnership between the government, civil society, and the lay public or the lay community. So that level of community engagement, whether that be a Kerala, whether that be our northeastern states, where it's actually community organizations which have taken the onus of ensuring reliance and adherence to public health measures. They are the ones who are ensuring that anyone who ventures out is wearing a mask. They are the ones who are ensuring that hygiene measures are met. So unless you have that kind of championing, rather than the police being out there and literally hitting everyone with a danda if you're not wearing a mask, it's actually the communities which are rising to the occasion and partnering with the government, and that requires a certain trust between the community, the public, and the government. If people don't trust the government, they're not going to listen. So I mean, that's what's fundamentally also important. Rather than a blame game either way, we need to talk about partnerships between all of these sectors, because that's the only way we can succeed. I mean, we need that kind of championing from everyone, but that also requires people to come forward and talk to each other and trust each other.
Mr. RP Singh, if you heard that, you're not, of course, going to be addressing issues of what largely other people think of the government as being in denial. Clyde, just a bit here, please. Mr. RP Singh, you've just taken one query to him here. Let's also talk about what the WHO has just said, and this is not specifically to India, of course. This is across countries, several countries that have opened up and have gone back to partial lockdown stages here, where the WHO warns that opening up right now with your eyes shut is a huge mistake that a lot of governments across the world are making. Mr. RP Singh.
Let's understand, there are hard options that we can't keep the country under lockdown for long. Just very clear. But yes, we have to be cautious. Earlier panelists were saying that states where people have participated, people are participative in this fight against the COVID, they are doing better. And yes, police also has a role to play. It has to make people understand that without mask or without maintaining a social distance, you can't be in public life now. And then gradually people are also understanding, and there's a lot of media support also in that. I mean, I've seen a lot of media like your channel and other channels are doing a lot of work on this, where they are telling people how to maintain social distance and where to wear a mask. So it's a combined effort put together. But whatever the WHO says, we can't stay under lockdown. We have to gradually keep opening up, and gradually people also will be mature, and we are hoping by another some months. I'm not giving that exact number of months, but hopefully by some months we'll have the vaccine also, and that's the time when things will be better. But we can't stay in lockdown for long, or we can't hold the economy for long, or we can't hold people for long from being into normal state.
Right. Clyde, you wanted to comment at this point. Please go ahead.
Yeah, please give me a couple of minutes. I just want to make 2 points here. Now that you spoke about the WHO, I think the WHO has said it very well, because we cannot get it out of this thing with our eyes shut. We need to tread very carefully. And while treading carefully, we need to make sure a lot of things are falling into place. For example, you spoke about, can we rely only on the numbers? Now, these numbers that we keep looking for, whether it's the recovery rate or whether it's a doubling rate or increase growth rate in the deaths per se, we need to look at these numbers, because I'll tell you why. We need to look at these numbers because these numbers tell us how our unlocking phases are working. If these numbers do not improve, then there's something wrong, because if we are unlocking, then the cases are rising. We need to study that very well. So these numbers are very important, because if the numbers don't improve, then we have to be very careful. And for example, there are a lot of things that the central government has given guidelines about, and we have not continued that in the state, because according to the location or according to the locality, we need to work on the cases accordingly. So therefore, a lot of things, for example, our trains will not work in Maharashtra, metro will not work in Maharashtra the way it will work in Delhi. So we have to keep our eyes wide open and tread very carefully in this whole thing. The second thing, the doctors definitely know much better than us. And I mean, you might find it strange that it's coming from someone from a political party, but then I completely agree with the doctors when they say that our health infrastructure, our health, kind of the systems have to be falling into place. And that's a fact, because whatever's happened in the past, I think now this has been a big wake-up call for all of us, for governments across the country, across the state, and even across countries, that we need to set up our health systems well. We need to work on our health infrastructure. Other things will continue. But if there's no good health system in place, these pandemics or any things like these will keep coming, then we're going to keep suffering. So I think it's a wake-up call for every government. It's a wake-up call for every individual, that we need to start looking at our health seriously. And I think it's about time we do that. And while doing so, this is the right time for people to cooperate with the governments, come together and make sure that, we adhere to all the guidelines that have been laid, because it's only for their good. I think Dr. Bhan said
Clyde,
that, what is
let's
the
talk
point?
about the learnings of what you're mentioning here, specifically here. Unfortunately, as far as Mumbai is concerned, which did have a fatality rate of 5.2%, which was much more, which was at least 2.5-3 times more than the national average. What are your learnings from Mumbai that your government in the state will not want to repeat in Pune? Pune is the focus city right now across the country with the highest numbers today.
See, there's always a learning in everything, sir. I mean, I'm not denying anything of that. But you have to remember one thing. When you spoke about Bombay having the higher amount of mortality rate or cases, you have to understand that Mumbai bore the brunt of this whole pandemic right in the beginning, because all the international flights came into Mumbai city. And from Mumbai, the closest was what? Pune. People went into Pune city. People went out of the city. So I'm not saying that, we were like 100% right from day one. But I'm also saying that, this took us by storm, because international flights landed in Mumbai initially, and that's where it all started. So we were learning, and we've been learning from a lot of things that have come up. And I think we've done well. I think we've done well because the numbers are showing we have done well. But yes, we cannot stop here. We have to work harder. We have to continue, and learning is going to be every day. And one of the learnings that I would say is that, we have to keep working on our health infrastructure, the health systems, and which we are working on. I mean, you see the kind of work we're doing in the last few months or since the pandemic got. I think we are on the better side of everything.
Can I come in?
Mr. R.P. Singh, if you could step in at this point here, because this is only taking up from what Clyde Crasto has just mentioned, that it hasn't been exactly running parallel. As we have gradually, in a very phased out manner, opened up, the numbers have continued to rise. Has there been scrutiny on the rise in numbers with respect to opening up? Or is opening up just a chance that we're taking? Because, of course, there are much more pushing issues as far as the recovery of the economy is concerned. But this is still a chance that we're taking. We're well aware that the numbers continue to rise in whichever phase of opening up we have been.
Let's be very clear. We are all are mindful of that with opening up, numbers will add up and will increase. But are we prepared for that? As I said earlier, we are prepared for that. Are we able to fight back the COVID? Yes, we are able to fight back, and that's why our fatality rate is low still. And recovery rate is growing up day by day. So we open up, as I said, it's a calculated risk. We open up, and then the recovery rate goes up. And also, we are waiting for the vaccine. All put together is a calculated attempt to open our economy and open the society back so that the economy should grow. But there are hard options now, and people also want to go out and then be in their normal sphere of work. So we can't hold people for a long time under lockdown also.
Yes, but Mr. Singh, we're not increasing testing either. We are increasing testing very, very marginally if we take the rate of the number of positive cases per day. We're opening up, of course. But I want to know more specifics, our preparedness here, because the numbers are scary. They still are very scary. There is no attempt of fear psychosis, but they are scary.
No,
When will we push on our testing rates?
No. Testing rate is going up day by day. I mean, if my figures are right, there were more than 4 crore people who were tested in the country, and then there's no shortage of testing kits today. And then we can go as it will depend more on states because health is their concern, and then they can ask for as many kits. They're directly importing also. The kits are being manufactured here also. So that's not the issue today. The testing is not the issue at all. But as I said, the concern is that while we open, numbers will grow up. But are we prepared? Yes, we are prepared today. With numbers going up, we are prepared to give the facility to them, ensuring that if someone is COVID infected, can we take care of him today? Yes, we can take care of him today. Until he has some other diseases, comorbid diseases which are there with him. Otherwise, in a normal course, we are prepared to take on head-on with the COVID.
Dr. Bagai, if you could please respond to that. Do you see a strategy? Because a lot of what we've had Mr. R.P. Singh say here right now is really running on hope. We're pinning a lot of things on hope. We're still taking those chances here. Of course, we would think opening up means a rise in numbers. We have seen that through all the graded phases of unlocking here. There has never been a moment of the flattening of the curve is what I'm saying here. Do we still see that strategy, or is still pinning up a lot of things on hope? We hope to have the vaccine in 2 to 3 months. We hope to control the numbers in 2 to 3 months.
Yeah, I think the full issue of flattening the curve is not an important aspect at the present moment. What we really need to focus is to isolate the vulnerables, the elderlies, the comorbid patients who have comorbidities, have a national campaign which is compulsory of masking and social distancing. I think this is beyond any religious boundaries or any state boundaries. We need a very, very high concentration of decentralizing healthcare into smaller cities and towns and villages. And very critical is, let us not bank on a vaccine. You mentioned the word vaccine. The vaccine, I would probably say, is still few to many months away. The initial lot of vaccines, when they come and as and when they come, will be tested for its efficacy in a routine population at large scale. You will need more than one international company to supply this kind of vaccine. And the pandemic will only end when you have more than 60 to 70% of mass immunization of this public. In this, I must mention that the routine immunization at the present mothers is suffering. There is a decrease in almost 60 to 65% of routine care in children. So I think we need to balance the act between the ongoing diseases, the non-communicable diseases, and focusing on COVID. I'm still saying the only path forward is increasing expense on public health care, looking after the doctors, the medical workforce, having a doctors' welfare fund, building healthcare cities. It's a long task, it's a long way, but the only way to start is when we begin the first step today.
That's right. And we still, even in the midst of the pandemic, we still haven't seen those steps being taken. Unfortunately, there were small spurts of protest by doctors as well here on complaining about not being provided enough protective gear, on complaining about not being paid salaries for the past month, past 2 months, past 3 months. We still haven't even made that a formidable structure yet, even in the midst of the pandemic. Yes, Mr. Kovai Satyan, you wanted to come in, please.
Yeah, so I just want to make a point on this parameter on a broader perspective, since many specialists are there on the panel. The WHO and the West always set standards which we call as the best practices. But as far as a developing nation or an underdeveloped nation is concerned, we should look at ideal practices. That too, in the time of pandemic, when the onus is being left only to that particular nation or to that particular state and society, and the bonuses and the responsibilities lies within themselves. I think what India follows is the ideal practice at this time of pandemic. Yes, there are norms saying that test per million is the ideal standard, but there is always a difference. Feeding few hundreds is different from feeding few lakhs. So you go by the standard of testing per million is just a thumb rule. But India is following an ideal standard mechanism. So I would say that in future course of time, WHO will definitely look at the model what developing nations are carrying forward as far as pandemic is concerned. I think that should be best termed as ideal practices. For example, India has got alternate medicines. Yes, definitely they have explored and they have come out
All right.
successful in alternate medicines. And there are options, multiple options, manifold options available within the Indian healthcare system as a whole, starting from the hereditary input of the food what we take, starting
No,
from
but Mr.
BCG
Kovai
vaccine which we
Satyan,
are carrying
alternate
forward for
medicines
4-5
not proven
decades.
treatment yet.
Sorry, voice is...
Let's get in Dr. Bhan on this. That's an important point you've raised. It's an important perspective also as far as testing patterns in developing nations is concerned, but also India's use of alternate medicine, which is not a proven treatment. Dr. Bhan, please clarify that.
See, listen, everyone is open to any pathy, which is to say, even if it is alternative medicine, even if it's Ayush. But at the end of the day, you have to show the evidence. Whether you're using it for prophylactic purposes, treatment purposes, you have to go through structured studies which can prove without any element of doubt that this works or not. Whether that applies to allopathic drugs or Ayush drugs, we have to use the same standards. You can argue about what is the right design for those kinds of studies. But in the absence of evidence, you should not be promoting any of these therapies. Just in the same way, I wouldn't want any allopathic drug to be used when there is no evidence available. I mean, we need to have some minimum standards so that we do not give any false sense of protection, either from a prophylactic purposes or a treatment purposes. And then the last thing is, by all means, unlock. No one is going to say now that lockdown is a solution, but then unlock your treasury to spend on health. Unlock your mind to also recognize that health security is as important as any other security, and that COVID-19 is only this situation over the last few months. We might have a whole series of pandemics coming in the future. So the only way to actually prepare for that, for COVID-19 care, for non-COVID-19 care, is to spend more on health and spend it effectively in a way that we are better prepared as a nation to fight these kinds of fronts which will open up on a health perspective.
All right. On that note, we'll have to leave it at that. Appreciate all the... All right. We still have 1 more minute, please. Very quickly. Go ahead.
Thank you. I think we should look at health expenditure, what we are spending, as not as an expense, but an investment. Because if you look after the welfare and health of a nation, we will actually save money, save lives, and life cannot be valued in terms of a monetary gain. I think we need to spend a lot more. We need to look after the medical force a lot more and really concentrating on proven and tried evidence-based and not hit and try.
All right, we'll have to leave it at that. Appreciate you continuing to press on that here. Respecting our medical force, assuring them, giving them that protection and safety, and also nurturing much more in the health sector, which still hasn't happened. Thank you, gentlemen, all for being with us here. This is in an attempt to keep the precautions up. We are opening up, but remember, the numbers are still high. While the government will do what they have to do, the doctors will do what they have to do, the medical infrastructure will evolve and change and do more research on what they have to do. We as a nation, as people, need to be acting more responsibly here. What we've seen in several social occasions and festivals in the past year, we need to keep that restraint. Yes, these are very important moments in our life that we need to mark, but we still need to keep that restraint because we need to continue living. We don't want any occasion, event or festival to be a super spreader. We need to live through this alive. Let's believe that. Let's keep that in mind. This is a disease which actually kills. Keep that in mind as we work towards reining in those numbers. Thank you for being with us.